Hello, I'm Robin Fears, and I'm the moderator of this scientific session entitled Climate Action to Protect and Promote Health, Building and Sharing the Evidence. Thank you to all of you for joining us today. This presentation is one of 3 pre-recorded videos focusing on a speaker's material before all our panelists come together again in February during the live discussion. Why are we doing this? Well, climate change is happening here and now, and with increasingly adverse consequences for human health, as well as the environment. In this video, Dzau, President of the National Academy of Medicine, will be discussing climate change, a grand challenge for human health and equity. Later on in the video, Dzau and I'll be discussing further some of the issues he's raised. Welcome, Victor, and the floor is yours.
Thank you, Robin. It's great to see you. And good morning, good afternoon, good evening to everyone. Let me begin by saying how important this topic is to all of us globally, but particularly the intersection of climate change and human health. May I have the next slide, please? First, by way of introduction, we are one of the 3 US academies, the National Academy of Sciences, National Academy of Engineering, and the National Academy of Medicine. And together, we, in fact, look at major issues in science, engineering, medicine that affects society, affects the world, and important issues of policy and actions. Next slide. As far as climate change is concerned, this is a very important issue for us. As you can see, the 3 presidents of the National Academies, Dr. Marshall McNutt, Dr. John Anderson, and myself have released a statement emphasizing the importance of climate change impact on the society, how it is an existential threat, and we, the US National Academies, are committed to tackling this important issue. Today, I'm going to talk about principally on climate change and human health. May I have the next slide, please? So this slide, which I borrowed from Sir Andrew Haynes, whom I'm sure you all know well, published in the New England Journal of Medicine, summarizes the health outcomes that could be affected by climate change. As you can see on the top, increasing levels of carbon dioxide lead to rising temperatures, rising sea levels, and increasing extreme weather events. And of course, these will impact communities, society, and people. As you can see in the next level, it says the magnitude of health risk depends not only by the hazards created by changing climate, but also on sensitivity of the people, communities, and natural systems, and on the capacity of people, community, and health system to prepare and manage this increasing risk. Now, what are those risks and pathways? As you can see, the major pathways which climate change harms health include direct effects, such as through natural systems, on vector-borne diseases, and effects mediated through socioeconomic systems, such as health consequences of increased impoverishment. Finally, as you can see in the bottom, is how it directly impacts health. That is, a magnitude of health outcomes from, in fact, injuries, fatalities, mental health effects, heat-related illness and death, cardiovascular effects, asthma, respiratory diseases, and cardiovascular disease, infectious disease, cholera, leptospirosis, vector-borne diseases, malaria, dengue, Zika, West Nile, malnutrition, diarrhea disease, and forced migration. I should point out, of course, the most vulnerable group when it comes to climate change and impact on health are the disadvantaged communities, the children, the older adults, people of color, and people with low income. So climate change places undue burden on countries least responsible and least able to respond. Those are the low and middle income countries, which are experiencing multiple impacts simultaneously. May I have the next slide, please? So I want to emphasize the issue of equity, because as you can see that not all communities are affected equally. In this slide, it says, since 2008, 21.5 million people have been displaced by weather-related, sudden onset hazards, and that it's anticipated by 2050, the WHO projects 143 million people in sub-Saharan Africa, South Africa, and Latin America may be forced to migrate, so-called climate refugees. Also, we know that by 2030, about 100 million people could be displaced, forced into poverty. Importantly, children are affected, particularly children from impoverished background. 50 million children are underweight from the food insecurity. 140 are stunted. And in fact, many of them are going to grow up being greatly affected. About 500,000 children really, particularly in developing countries, each year they don't have access to clean water because of variability in rainfalls. And in the US, we do know the long-standing issues of inequity in system of health and housing, food, etc., have affected particularly the communities of color. And as you can see, if you look at the studies, in communities of color, there's about a 38% more, in fact, in terms of air pollution is exposed to them. So these are really issues of equity. Next slide. So why do we need to act as a health sector? Well, we have an obligation to act because, to me, it's a public health crisis. Also, we are one of the most trusted professionals in the world. And in fact, in society during COVID, if you look at the ranking, they trust the doctors and the nurses. So we should really sound the alarm and communicate these threats. We also have a duty to advocate for health and equity at the center of all planning and policy of climate change. And finally, we need to hold ourselves accountable. Next slide. As you can see, globally, the health sector is responsible for 5% of global carbon emissions. And US is as high as 8.5 to 10%. That's huge. And so we have a responsibility to do no harm, is our Hippocratic oath. Consequently, the damages from US healthcare pollution is estimated to be order of the magnitude of deaths from preventable medical errors. That's in fact reported by Jody Sherman from Yale. And this, of course, as I said, it particularly affects the marginalized population. So I think not only do we need to sound the alarm, we need to act and hold ourselves accountable to reduce the carbon emission and reduce financial cost of care and also disease burden as well. So we should act also as a catalyst. We do it together as a community. Other sectors may also do the same. Next slide. And this is why I believe the time is now. The time to act is right now for our community. First of all, the IPCC 6th assessment report says it's already happening. And in fact, it's unequivocal that human-produced emissions of carbon dioxide and other greenhouse gases is now overwhelming driver of the climate change. And that if we don't act now, it will be too late. Second, I think COVID-19 is a harbinger of what can come if we don't act in preventing climate change impact in health. And third, I think it's an extraordinary moment when climate change and COVID are converging at the same time. So we need to elevate climate change to the same existential threat as COVID and pandemics. So we can take opportunity to drive innovation, integrate evidence-based policy at national, regional, and global levels, and empower individuals and communities to affect the transformative change. The news is good. At COP26, it did identify climate and health as a priority, and 52 countries have declared a commitment, including US, to in fact building climate resilience and sustainability. And 14 countries set a deadline of 2050 or earlier, by which health system will reach net zero. Next slide. So this is where we came in. The National Academy of Medicine decided to have a grand challenge. a grand challenge we can mobilize the entire US health sector to look at the following: how to improve human health and well-being and equity by working to transform the systems that contribute to health and climate change. And the strategic objectives are shown here. One is communicate, communicate, communicate. We have to be a spokesperson within our own profession, but also to the public. Second is to have a roadmap, which we'll talk about later, to look at how to bring all systems that impact both climate and health together to transform through policy changes, etc. Third is to act right now to catalyze action. And we have an action collaborative, which we have all the US health sectors together, including healthcare delivery and supply chain and big pharma and devices to come together to set goals, to start measuring, and to move towards supporting US administration's goals. And finally, we want to stimulate bold and interdisciplinary solutions to stimulate research and innovation, because by doing so, we can achieve the goals of improving health, reducing climate change impact, and improving equity. Next slide. So I want to emphasize for one slide on our action collaborative on decarbonizing US health sector. It's a public-private partnership. It brings together the leadership, CEOs, and healthcare workers from healthcare delivery, hospitals, health systems, clinics, doctors and nurses, to supply chain, and the CEOs of major pharmaceutical companies and major device and supply chain companies, and also the US government. So as you can see, the co-chair of this particular initiative is Sir Andrew Whitty, who used to be the GSK CSO, but now CEO, but now he's the CEO of United Optum. Mr. George Barrett, who's the former CEO of Cardinal Supply Chain. The Honorable Rachel Levine, who's Assistant Secretary of Health, overseeing climate and health equity, and myself. And together you can see we have participants from the federal government, the hospitals, health systems, payers, and finance entities, health profession, education stakeholders, industry, supply chain, biopharma device, nonprofits, academia, and more. And we're looking at how to move forward together to have measurements and goals to move together towards decarbonizing the US health sector. Next slide. So my final slide, how has this got to do with this meeting today? Well, US is not an island. We recognize that we need to work globally. And what I believe NAM Grand Challenge can do is to have lots of interaction partnership with our global partners. For example, we want to create Empower with Evidence, research that explores and shares the evidence-based strategy that can be applied globally. Secondly, we want to build scientific and equitable partnerships, opportunities to bring scientists and global communities together to build a global scientific community with our friends everywhere in the West, but also in low and middle income countries, so that we can together look at mitigation and adaptation strategies. I believe that in what we can do, we can provide opportunities to provide technical and financial assistance to the low-income countries to mitigate, adapt, and of course, open source tools and data to be shared and knowledge. Next slide. So I believe that we are very excited about this meeting by bringing together the other academies, IAP, and of course, looking forward to hearing their report, as well as the Americas and other low-income countries. Thank you very much.
Thank you, Victor, for your thoughtful and very stimulating presentation. We now have about another 10 minutes to discuss further some of the many issues that you've raised on climate change and health. Perhaps I could start with picking up a point from your last two slides. You identify what one of the priorities for your academy relating to options for the health sector itself, reducing its carbon footprint while increasing resilience to adaptation to climate change. Now, this is a shared objective in many other countries worldwide, and you mentioned some of that from COP26. But of course, the US healthcare system is a little bit different from the system in a number of other countries. Can you say a little bit more about the extent to which the reforms that you'll be discussing in the US might be relevant and applicable to stimulating reflection and action in other countries as well as the US?
Thank you, Robin. You're right. In some ways, we are quite different from the others. We're certainly different from UK, where you're from, and from Singapore, because we don't have a single payer. We don't have a national health system. And so our care is more distributed between public and private hospitals, different practitioners, government and private insurance, etc. So our job is to bring everyone together. So this also gets how we're similar to all of you, because at the end of the day, the common goal everywhere would be to mobilize the entire health sector to work together. And of course, as I said, the health sector is made of diverse actors and stakeholders, from hospitals to clinics to private sector, supply chain, government, policymakers. So we can together decarbonize and develop new resilience. I think that's where the real opportunity is. So I hope that our effort will serve as a model, because I know in UK, NHS is doing this. Obviously, the supply chain side is getting a lot of pressure. They also are mandated to do this. What our collaborators doing is under one roof to plan together, to measure together, and to work forward together. This collective approach of having measurements and to have goals and to have action, I think is something that I believe can be shared with others as well. So I think we are different, but to some extent, we really have the same goals, and what we can do can be shared globally.
Thank you. Thank you very much. As you observed, also, of course, the issues surrounding the broad impacts of climate change on health are not a matter only for action in the health sector, but across all sectors. How can we, in academies, ensure better coordination between sectors to facilitate essentially health in all policies, particularly with regard to mitigation and adaptation solutions, and thereby at least avoid inadvertent consequences of action in one policy area on health, trade-offs and synergies, and really what other sectors are most important to look at for their health impacts?
Robin, it's a great question, and I think you're making a very important point. Climate and health outcomes are greatly influenced by interaction in many different systems. Beyond just healthcare, as you said, includes water, food, agriculture, housing, transportation. So we have to realize health in all policies. And to do so, we need collaboration at all levels across sectors in government that incorporates health equity sustainability into policies, programs, processes, and decision-making. You know, this will require cross-sector adoption of key indicators and data collection to monitor health status and vulnerabilities in the context of a changing climate. As you said, we also have to avoid inadvertent negative health consequences of action in other sectors. We also need to understand, as you said, policy trade-offs and capture synergies. All that is so important. This is why in our grand challenge, if you remember, our first strategic direction is to do a roadmap for systems transformation, because we're focused on intersection of major economic sectors as they relate to individual and population health in the context of climate change. So our question would be, how can we redesign and promote a more equitable, climate-sustained economy that has a health-promoting, health-centric focus? Our roadmap, which is going to be an extensive study, will lay out those critical opportunities to reframe the economic model in this way and provide recommendations for policymakers, public and private sector leaders, and entities to facilitate the transformation by recognizing that all these systems are intersecting, interacting, and we need to work together.
Thank you. Following on from that point, as you know, the theme of the 22 AAAS meeting is empowering with evidence. You already mentioned COP26 and the encouragement for a higher visibility of health in some respects. Do you think that the issues for health have high enough visibility yet in global political discussions on climate change? If not, in what ways might health professionals continue to help lead that discussion?
Right, I think you're spot on. I mean, as you know, historically, we have not been that visible in global discussions of climate change, but I think it's starting to change. First of all, I think COVID is a wake-up call, and it made health prominently in everybody's mind as an existential threat. And one could argue that climate change impact far exceeds that of COVID in terms of societal threats and impact on health. So we need to seize that moment to put that in the forefront of everybody's mind in terms of climate and pandemics. But secondly, as you said, I think the health narrative has become more prominent in this past year because of your good work, because of IAP, National Academy, and all of us. And I think that the prominence at COP26 is a very encouraging sign because health was chosen as a science priority area. And that we did bring together health professionals, researchers, health ministers around the world to engage in discussion and advocacy. I think there's still a lot more work to do, even though this has been really good progress. And I think the way I believe to elevate the health impacts of climate change and ensure that public health is at the table in climate negotiation is that all of us, health professionals, have an important role. You talk about evidence. First of all, we need to really show the evidence of climate change and human health. If you think about this, what does an average person care about? They care about economy, security, and health. And if we use the voices of clinicians and health professions to put forward the issue of public health crisis, equity crisis, and educate our own professionals and educate the public about this and communicate these messages, I think that we would be even more visible. And here is what I think the Academy is particularly impactful by able to organize this across our own countries.
Thank you. Thank you very much. I think we have time for one more question, and coming back and emphasizing again that the global context, which you've already mentioned several times, that the US is a high greenhouse gas emitter. Is there anything more you'd like to say about how the scientific community in the US can help others, particularly in those low-income countries who are not high greenhouse gas emitters, but yet may be suffering more severely from the health impacts of climate change?
I know you don't have time to add for any more questions, but I do want to say the AAAS report is, we totally support it. And we do see that our work is across the globe. First of all, Americas, because we share the same land, the Western Hemisphere. Everything we do with trade, with economy, with agriculture, affecting each other. So we need to work together. We also believe in our low and middle income colleagues in Africa and everywhere else. Exactly what you said, because they are the recipient, if you will, of the bad things that many of the rich countries do in terms of climate. In terms of science, your question for me, yes, I do think that what we can do in US can be helpful to others as well, but it's not only US, it's UK and everybody else. First of all, I think Academies about science. We need to do more research to find strategies that reduce greenhouse emission. In US, in UK, in China, and everywhere else, that contributes to global emission that affect low-income countries. We need to find novel approaches that can be applied globally. I said earlier in my talk, we need to find scientific partnership, bring scientists globally from high-income countries, low, middle-income countries together, form a community that can work together and look at mitigation, adaptation strategies. Also, for countries like ours, we have a chance to provide technical assistance for mitigation and adaptation strategies to low-income countries. I think importantly, I would hope that the lessons we learn from US, from high-income countries are reasons for low countries to avoid, because the high reasons for the way we care for people, the use of technology versus the idea of more community prevention to reduce the emission is something that people can learn from us. And of course, as I said earlier, we need to have open source tools that can be shared globally, data collection, data sharing. So lots of opportunities, Robin.
Thank you, Victor, and thank you again very much for your slides and for your energetic discussion. Clearly, we could discuss these issues for very much longer if we were allowed, but sadly, we've run out of time. However, we do have another opportunity in February during our online discussion. So let me close by thanking you and thanking all of our audience for watching this. And just a reminder to our audience that this is one of the 3 spotlight videos focusing on the individual work of speakers who will be brought together in our session in February in the panel on climate action to protect and promote health, building and sharing the evidence. So look forward to seeing you there and indeed to hearing questions from the outside world. So I wrap up now. Thank you, Victor, very much. Thank you for our audience and look forward to seeing you in February.